Welcome to Men's Health 365, where we explore evidence-based strategies to optimize your health, vitality, and sexual function. After 60, I'm your host, and today we're covering a topic that could literally save your life: the hidden warning signs your prostate is sending you right now that you're probably ignoring or dismissing. Most men know about the obvious prostate symptoms like difficulty urinating or frequent nighttime bathroom trips, but what I'm about to share are 3 subtle, easily overlooked signs that often appear months or even years before the obvious symptoms develop. These early warnings give you a critical window to intervene, potentially preventing prostate cancer, avoiding invasive treatments, and maintaining your quality of life. If you're a man over 50, what you learn in the next few minutes could be the most important health information you receive this year. Before we dive into the 3 hidden signs, let me share James's story. At 61, this sales executive from Chicago considered himself healthy and active. He had no urinary symptoms, no pain, no obvious problems. But during a routine physical exam, his doctor noticed something subtle that James had completely dismissed: changes in his ejaculate. My doctor asked if I'd noticed any changes in my semen, James recalled. I mentioned casually that the volume seemed less than it used to be, and occasionally there were small streaks of discoloration, almost brown. I'd noticed it a few months earlier, but figured it was just part of getting older. I wasn't having any other symptoms, so I didn't think much of it. James's doctor didn't dismiss it. He ordered a PSA test, which came back elevated at 7.2 nanograms per milliliter. Further evaluation, including an MRI and biopsy, revealed early-stage prostate cancer that was completely treatable because it was caught early. If my doctor hadn't asked about that subtle symptom I'd dismissed, and if I hadn't mentioned it, the cancer might not have been detected until it was much more advanced, James said. A small change I thought was meaningless turned out to be an early warning that saved my life. James's experience illustrates a critical principle. Your prostate sends warning signals long before obvious symptoms develop, and paying attention to these subtle signs can make the difference between early, treatable disease and advanced, difficult-to-treat disease. Let me reveal the 3 hidden signs your prostate wants attention now. Hidden sign number 1, changes in ejaculate volume, consistency, or color. The first hidden sign that most men completely overlook is changes in their ejaculate, the semen released during orgasm. Many men assume that decreased ejaculate volume is just a normal part of aging and nothing to worry about. While some decrease is normal with age, significant changes or other abnormalities can be important warning signs. Let me explain what's normal and what demands attention. Normal age-related changes include gradual decrease in volume over many years, with average ejaculate volume decreasing from about 3.5 milliliters in younger men to about 2 milliliters by age 70. This gradual change over decades is expected. What's not normal and demands attention includes sudden or dramatic decrease in ejaculate volume over weeks or months, complete absence of ejaculate during orgasm, called anejaculation or aspermia, discoloration of semen including yellow, brown, or pink coloring, blood in semen called hematospermia, which appears as red, brown, or rust-colored streaks or uniform discoloration, and significant changes in consistency, such as semen becoming very thick and lumpy or very thin and watery. Why do these changes matter for prostate health? The prostate produces approximately 30% of seminal fluid, with the seminal vesicles producing about 60% and other glands contributing the rest. Changes in ejaculate can indicate prostate inflammation, prostate infection, prostate enlargement causing obstruction, or prostate cancer. Research published in the Journal of Urology has documented that hematospermia, or blood in semen, while often benign, can be the presenting symptom of prostate cancer in 2 to 4% of cases, particularly in men over 50. More commonly, it indicates prostatitis or benign prostatic hyperplasia, but it should never be ignored. Sudden significant decrease in ejaculate volume can indicate obstruction of the ejaculatory ducts, often caused by prostate enlargement, inflammation, or rarely, tumors. A study in urology found that men with ejaculatory duct obstruction frequently had underlying prostate pathology requiring treatment. Complete absence of ejaculate, if not caused by medications or retrograde ejaculation where semen goes into the bladder, can indicate significant obstruction requiring investigation. Changes in semen consistency or appearance can indicate infection or inflammation. Prostatitis, or prostate inflammation, commonly causes changes in seminal fluid along with other symptoms like pelvic discomfort, pain with ejaculation, or urinary symptoms. James had dismissed decreased volume and occasional brown discoloration as normal aging, but these were early warning signs of prostate cancer. The brown color indicated old blood that had been present long enough to oxidize, and the decreased volume reflected dysfunction in prostate secretion. Because his doctor asked about it and took it seriously, James's cancer was detected at stage T1C, confined entirely to the prostate, with a Gleason score of 6, low grade. He was treated with active surveillance initially and eventually with focal therapy, avoiding radical prostatectomy and maintaining full urinary and sexual function. If detection had been delayed until obvious symptoms developed, his outcome might have been very different. Your action steps for this hidden sign are straightforward. Pay attention to your ejaculate. Notice volume, color, and consistency. Don't dismiss changes as just aging. If you notice blood in your semen, even once, see a urologist promptly. If you notice significant decrease in volume over a short time period, mention it to your doctor. If you notice persistent changes in color or consistency, get evaluated. If you're sexually active, self-monitoring is easy. If you're not sexually active, consider that regular ejaculation is actually protective for prostate health, with research in JAMA showing that men who ejaculate 21 or more times per month have significantly reduced prostate cancer risk compared to men who ejaculate less frequently. Hidden sign number 2, subtle changes in urinary stream that you're compensating for. The second hidden sign is subtle changes in your urinary stream that you've unconsciously adapted to and may not even consciously recognize as abnormal. Most men know that a weak urinary stream or difficulty starting urination are signs of prostate problems, but by the time these symptoms are obvious and bothersome, prostate enlargement or other pathology is already advanced. The hidden early warning is subtle changes that you're compensating for without realizing it. Let me describe what I mean. Hidden urinary changes that demand attention include needing an extra second or two to start urination that you've adjusted to by standing at the toilet a bit longer before flow begins, slight decrease in stream force that you compensate for by standing closer to the toilet, intermittency, where the stream stops and starts briefly during urination that you've learned to expect and wait through. Post-void dribbling, where small amounts of urine leak after you think you've finished, which you manage by shaking longer or squeezing, and a sensation of incomplete emptying that you've adapted to by urinating more frequently. Here's the critical point. Because these changes develop gradually over months or years, and because you unconsciously adapt your behavior, you may not recognize them as abnormal until someone specifically asks about them or until they progress to the point of being obviously problematic. Research in the Journal of Urology has documented that men significantly underreport early lower urinary tract symptoms because gradual onset allows adaptation, and most men assume age-related changes are normal and not worth mentioning. By the time symptoms are severe enough that men seek treatment, prostate volume has often increased substantially. Bladder function may be impaired from chronic obstruction, and treatment becomes more complex. Why do these subtle urinary changes matter? The prostate surrounds the urethra, the tube that carries urine from the bladder through the penis. As the prostate enlarges, which happens to virtually all men with benign prostatic hyperplasia, affecting about 50% of men by age 60 and 90% by age 85, it gradually narrows the urethral channel, creating increasing resistance to urine flow. Early in this process, your bladder compensates by contracting more forcefully to push urine through the narrowed channel. This compensation maintains relatively normal flow, and you may not notice problems. But over time, the bladder muscle thickens from working harder, eventually becoming less efficient and potentially developing overactivity or weakness. Additionally, chronic incomplete emptying increases risk of urinary tract infections, bladder stones, and kidney damage from back pressure. More importantly, while benign prostatic hyperplasia is the most common cause of these symptoms, prostate cancer can cause identical symptoms, and early detection is critical. Research in the Journal of Clinical Oncology has documented that men who seek evaluation for mild lower urinary tract symptoms are more likely to have localized, curable prostate cancer compared to men who delay until symptoms are severe, by which time cancer is more likely to be advanced. The hidden sign is the subtle change you're already compensating for without consciously recognizing it as abnormal. Let me give you a specific self-assessment. Answer these questions honestly. Does it take you longer than 1 to 2 seconds to start urinating after you position yourself? Do you need to push or strain to start urination, even slightly? Is your stream noticeably weaker than it was 5 years ago? Does your stream stop and restart during urination? Do you dribble after you think you've finished urinating? Do you shake or squeeze your penis to expel remaining urine? Do you feel like your bladder doesn't empty completely? Do you urinate more frequently than every 2 to 3 hours during the day? Do you get up more than once per night to urinate? If you answered yes to 2 or more of these questions, your prostate is sending you a warning signal that deserves medical evaluation. These symptoms don't necessarily mean cancer, but they do indicate prostate enlargement or dysfunction requiring assessment and potentially treatment. Gerald, a 67-year-old patient of mine, had gradually developed several of these compensatory behaviors without recognizing them as abnormal. His wife noticed that he took longer in the bathroom than he used to and mentioned it casually. When I asked specific questions about urinary function, Gerald realized he'd been standing at the toilet for 5 to 10 seconds before flow started, which he'd unconsciously accepted as normal. His stream was weaker than years earlier, but the change had been so gradual he hadn't consciously registered it. He was getting up twice nightly to urinate, which he attributed to age and drinking water before bed. His PSA was 4.8 nanograms per milliliter, mildly elevated. An MRI revealed a suspicious lesion, and biopsy confirmed Gleason 3+4 prostate cancer. Because it was caught relatively early due to investigation of mild symptoms, he was a candidate for multiple treatment options and chose focal therapy with excellent outcomes. Your action steps for this hidden sign are to actively assess your urinary function, rather than passively accepting gradual changes. Use the questions I provided to honestly evaluate your symptoms. If you have 2 or more positive responses, schedule a urology evaluation. Get baseline testing, including PSA blood test, digital rectal exam, and potentially uroflowmetry to objectively measure stream strength. Don't wait until symptoms are severe or obvious. Early intervention, when changes are still subtle, allows for more conservative treatments and better outcomes. Hidden sign number 3, unexplained changes in sexual function beyond just erectile issues. The third hidden sign is changes in sexual function beyond just erectile dysfunction, which most men know can be related to various health issues, including cardiovascular disease, diabetes, and hormonal problems. The hidden signs I'm talking about are more subtle sexual changes that men often don't connect to prostate health. These include pain or discomfort with ejaculation, called dysorgasmia, which can range from mild discomfort to significant pain in the perineum, the area between the scrotum and anus, the penis, the lower abdomen, or the rectum during or immediately after orgasm. Decreased intensity or pleasure of orgasm that develops over weeks or months rather than gradually over many years. Changes in libido or sexual interest that can't be explained by psychological factors, relationship issues, or other obvious causes. pelvic discomfort, or a sense of fullness or pressure in the area between the scrotum and anus, particularly after sitting for long periods or after bowel movements. Why do these sexual changes matter for prostate health? The prostate plays a central role in sexual function. During arousal and orgasm, the prostate contracts rhythmically to expel prostatic fluid into the urethra as part of semen inflammation, infection, or other prostate pathology can cause pain or discomfort with these contractions. Prostatitis, or prostate inflammation, is a common cause of ejaculatory pain and affects up to 50% of men at some point. It can be bacterial, requiring antibiotics, or non-bacterial, requiring other treatments, but it should be diagnosed and treated. Research in the Journal of Sexual Medicine has documented that chronic prostatitis significantly impairs sexual function and quality of life, and early treatment improves outcomes. Prostate cancer, particularly as it advances, can cause pelvic discomfort, changes in orgasmic sensation, and decreased libido through various mechanisms, including local effects of the tumor, hormonal changes associated with advanced disease, and psychological burden. Additionally, the nerves controlling erection run very close to the prostate, and prostate disease can affect these nerves, causing erectile dysfunction. While ED alone doesn't necessarily indicate prostate problems, ED combined with other subtle symptoms increases concern. Research in the International Journal of Impotence Research found that men with erectile dysfunction and lower urinary tract symptoms had higher rates of prostate pathology compared to men with ED alone. The pelvic discomfort or sense of fullness that some men experience can indicate prostatitis or prostate enlargement, causing pressure on surrounding structures. This symptom is often vague and intermittent, making men hesitant to mention it, but it shouldn't be ignored. Andrew, a 58-year-old patient, had been experiencing mild discomfort with ejaculation for about 4 months, which he described as a dull ache in the area between his scrotum and anus that lasted for 5 to 10 minutes after orgasm. He also noticed that orgasms felt less intense than they used to. He almost didn't mention these symptoms to his doctor because they seemed embarrassing and not severe enough to warrant medical attention. His doctor fortunately took them seriously and ordered a PSA test, which was 6.4 nanograms per milliliter. Further evaluation revealed Gleason 3+4 prostate cancer. Andrew's ejaculatory discomfort was an early symptom of the tumor, and because he mentioned it and his doctor investigated, the cancer was caught at a stage where cure was possible. The key message is that sexual function changes are not just normal aging or psychological issues to be dismissed. When they develop relatively suddenly or progressively worsen over weeks or months, they warrant evaluation. Your prostate and surrounding structures are trying to tell you something. Research in the Journal of Urology has documented that men who report sexual dysfunction symptoms, along with even mild urinary symptoms, have higher rates of significant prostate pathology compared to men with urinary symptoms alone. The combination of symptoms increases diagnostic suspicion. Your action steps for this hidden sign are to pay attention to all aspects of sexual function, not just erections. Notice and report pain or discomfort with ejaculation, changes in orgasm intensity or pleasure, pelvic discomfort or pressure, and changes in libido that aren't explained by obvious causes. Don't dismiss these as just getting older or stress. Mention them to your doctor even if they seem minor or embarrassing. Urologists discuss sexual function all day, every day. Nothing you say will surprise them. Get comprehensive evaluation, including PSA, digital rectal exam, and consideration of prostate imaging. If symptoms and risk factors warrant why these hidden signs matter so much, let me emphasize why recognizing these 3 hidden signs matters profoundly. Prostate cancer is the most common non-skin cancer in men, and the second leading cause of cancer death in men after lung cancer. About 1 in 8 men will be diagnosed with prostate cancer during their lifetime. However, when caught early while still confined to the prostate, the 5-year survival rate is nearly 100%. When detected after it has spread to distant sites, the 5-year survival rate drops to about 30%. The difference between cure and death often comes down to early detection. The challenge is that early prostate cancer typically has no symptoms. By the time obvious symptoms like bone pain, weight loss, or severe urinary obstruction develop, cancer is often advanced. This is why screening with PSA testing and digital rectal exams is recommended for men at average risk starting at age 50, and earlier for high-risk men, including African American men and men with family history. But even with screening, some cancers are missed or develop between screening intervals. The 3 hidden signs I've described often appear before routine screening would detect a problem, giving you additional opportunities for early detection. They're your body's early warning system, telling you that something isn't right and deserves investigation. Beyond cancer, these signs can indicate benign but significant conditions, including benign prostatic hyperplasia, requiring treatment to prevent complications, acute or chronic prostatitis requiring antibiotics or other therapy, and ejaculatory duct obstruction requiring intervention. Early detection and treatment of these conditions prevents progression, complications, and impairment of quality of life. Research consistently shows that men who seek evaluation for mild symptoms have better outcomes across all prostate conditions compared to men who delay until symptoms are severe. Your complete action plan. Here's your complete action plan to protect your prostate health. First, know your risk. Average risk men should start prostate cancer screening. With PSA and digital rectal exam at age 50, high-risk men, including African Americans, and men with first-degree relatives who had prostate cancer should start screening at age 45. Men with multiple family members with prostate cancer should discuss screening starting at age 40. Second, pay attention to the 3 hidden signs: changes in ejaculate volume, consistency, or color, subtle urinary changes you're compensating for without realizing, and sexual function changes beyond just erectile issues. Third, don't dismiss subtle symptoms as just aging. While some changes are normal with age, abnormal changes deserve evaluation. When in doubt, ask your doctor. Fourth, get regular screening according to guidelines. PSA testing is controversial because of concerns about overdiagnosis and overtreatment, but for men who want to minimize their risk of dying from prostate cancer. Fifth, maintain prostate health through lifestyle, including regular exercise, which research shows reduces prostate cancer risk. A diet rich in vegetables, particularly cruciferous vegetables and tomatoes, healthy fats including omega-3s, while limiting saturated fat, maintaining healthy body weight, regular sexual activity and ejaculation, and avoiding smoking. Sixth, know your PSA number and track trends over time. PSA velocity, or how quickly PSA increases over time, is often more informative than any single value rapidly rising. PSA deserves investigation even if the absolute value isn't dramatically elevated. Seventh, don't hesitate to seek a second opinion. If you're diagnosed with prostate cancer or another significant prostate condition, getting a second opinion from another urologist or a specialized prostate cancer center ensures you understand all your options and choose the best treatment for your situation. James, Gerald, and Andrew, the 3 men whose stories I shared, all had one thing in common. They experienced subtle warning signs that they initially dismissed or didn't recognize as significant because they, or their doctors, paid attention to these hidden signs and investigated appropriately. Serious conditions were detected early when treatment was most effective. Their outcomes were dramatically better than if they'd waited for obvious symptoms. I tell every man I know now, James said at his 5-year cancer-free follow-up, pay attention to your body. Subtle changes matter. Don't wait for obvious symptoms. Those small warning signs could save your life. The 3 hidden signs your prostate wants attention now are changes in ejaculate, subtle urinary changes you're compensating for, and sexual function changes beyond just erectile issues. These signs appear early, often months or years before obvious symptoms develop. Recognizing them and seeking appropriate evaluation can detect prostate cancer at curable stages, identify benign conditions before they cause complications, prevent unnecessary suffering and treatment complexity, and potentially save your life. Your prostate is communicating with you through these subtle signals. The question is whether you're listening. Pay attention, take action, and prioritize your prostate health. It could be the most important health decision you make. Thank you for watching Men's Health 365. If you found this helpful, please like, subscribe, and share with men who need this potentially life-saving information.